Chapter 12, Fat-Soluble Vitamins, Screencast 3. We're now going to be focusing on vitamin D. Now, this is classified as a vitamin, but it can also be synthesized by the body in the presence of ultraviolet light or sunlight. Quite often, it's more correctly classified as a prohormone or a precursor of active hormones. Now, if we look at vitamin D2 in foods, this is also known as ergocalciferol. And one thing to remember here is this is not as active as vitamin D3. Sources of this are going to be fatty fish, cod liver oil, fortified milk, and also fortified breakfast cereals. So here we can basically, on the image, see a few good sources of vitamin D, and we can see salmon, cod liver oil. All of them are relatively very, very good sources of vitamin D that we can find within our food. Now, if we look at how this is actually formed within the skin, so we're going to start off with 7-dehydrocholesterol within the skin. Now, the exposure to sunlight is going to transform this substance to cholecalciferol, that is vitamin 3. Cholecalciferol will enter the bloodstream, and it's going to go to the liver and kidneys, and this is where it's actually converted to calcitriol, and this is the bioactive form. Now, when we look at sun exposure, it's going to provide anywhere from 80 to 100% of required vitamin D3. Now, the amount of sun exposure will depend on time of day, the geographic location, the season of the year, age, skin color, and also use of sunscreen. Now, one thing to keep in mind here is prolonged exposure to sun will not result in toxic amounts. Excess amounts of pre-vitamin D3 will actually be degraded. Here we basically look at the impact that how far you are equator has on the formation of vitamin D. And what we can see here, as we are further away from the equator, there is less UV light, and this is going to result in less formation of vitamin D through exposure to sunlight. Now, when we look at adequate intake, so keep in mind we're looking at 15 micrograms per day under the age of 51 years. Now, as someone is older, we're still seeing 51 micrograms between 51 and 70, but then after 70, we start to see an increased need, and it's now up to 20 micrograms. Now, the daily value is 20 micrograms. Now, one thing that is important to realize, breastfed babies should be given a vitamin D supplement. Now, one thing I want to be really clear, once again, you are not responsible for memorizing these values. They're just being addressed so that you've heard of them and are somewhat familiar with them. Now, 80% of vitamin D2 is going to be absorbed in the small intestine, and it's going to be transported to the liver via chylomicrons. Now, vitamin D3 or D2 entering circulation will be bound to vitamin D binding protein, and that is how it's going to be transported. In the liver, vitamin D is converted to calcidiol. Eventually, this goes to the kidneys, and it's going to be converted into calcitriol, and that is the active form of vitamin D. Formation of calcitriol is going to be regulated by the parathyroid gland and kidneys. If blood calcium levels are low, parathyroid gland will make more parathyroid hormone. Parathyroid hormone increases the production of calcitriol in kidneys and is responsible for restoring calcium balance. Generally, vitamin D will be excreted in bile. Here we basically look at the ultimate functions of vitamin D within the body. So ultraviolet light from the sun converts to vitamin D3 within the skin. Dietary vitamin D2 is absorbed with dietary fat in the intestine, and vitamin D from both dietary sources and synthesis within the skin are bound to carrier proteins to the bloodstream and transported to the liver. Here, vitamin D is converted to calcidiol. Vitamin D is converted in the kidney to calcitriol. Now here we're basically looking at the control or regulation of calcium that's tied into this. So the first thing that we want to look at here is low blood calcium level, and that is going to increase the production of parathyroid hormone. This will result in two different things, decreased calcium excretion and also increased synthesis of vitamin D3 within the kidney. those can actually result in normal blood calcium levels, but also we're also going to see increased calcium absorption within the small intestine, and once that also will give us normal blood calcium levels. Now, when we look at high blood calcium levels, now we're going to look at increased levels of calcitonin. High blood calcium levels will cause increased synthesis of the hormone calcitonin, and this is going to promote calcium deposits in the bones to help blood calcium levels return to normal. Now, if we look at some of the functions associated with vitamin D, this would be vitamin D2. It may help regulate immune function, secretion of some hormones, and the cell cycle. It may also decrease the risk of infections and some autoimmune diseases, and it will help protect against diabetes, high blood pressure, dementia, and some cancers. Now, when we look at diseases that are associated with a vitamin D deficiency, you may have actually heard about rickets. Rickets is the abnormal mineralization of bones in children, and bones will actually become weak under pressure and have a bowing appearance. Signs may include enlarged head, joints, and a rib cage, deformed pelvis, and bowed legs. Things that can be associated with are fat malabsorption, cystic fibrosis, a dark skin, low milk intake, and also a minimal exposure to sunlight. Another deficiency disease is osteomalacia, and what this is a poor calcification of newly synthesized bones in adults. This results in bones that fracture easily. This might be seen in adults with kidney or liver disease, a problem with absorbing fat, dark skin, or a limited exposure to ultraviolet light. Now, if we look at vitamin D toxicity, this is something that can occur with supplementation. This does not occur from the exposure to sun or consuming vitamin D high foods. The upper level is set at about 100 micrograms per day for age 9 and older. Above this, we can start to see excess levels of calcium within the blood. We might see calcium deposited in the kidneys, heart, and lungs, potential for anorexia, nausea and vomiting, a demineralization of bones, weakness, joint pain, and kidney dysfunction.